Okay, so welcome back to Voices in Health and Wellness. This is the podcast where we explore what's shaping the future of care, from inside the clinic to the heart of the community. I'm your host, Dr. Andrew Greenland, and today's guest brings a rare blend of clinical insight and entrepreneurial energy to the table. Joining me today is Dr. Eric Bloom, Doctor of Physical Therapy, board-certified orthopedic clinical specialist, and founder of Bloom Performance and Rehab. Eric has built something unique, a fast-growing practice that's not only redefining patient care in Arizona, but also extending its impact through corporate wellness partnerships across the US. At the intersection of rehab, performance, and preventative care, Eric is helping to bridge the often missing link between clinical outcomes and everyday wellness. So in today's episode, we'll dive into how he's scaling his vision and why integration, not specialization, is the future of medicine. So, Eric, thank you very much for joining us on the show.
Thanks for having me, Dr. I appreciate being here. Thank you.
Really appreciate your time. So could you maybe talk through what your role looks like at Bloom Performance and Rehab, just to kick us off?
Yeah, so I started this probably about 8 years ago. So I've been out in practice 16 years. So I kind of wanted to figure out, I saw the trend early on in my career with just the way, medicine was going. And I think this is not just here in the States, but, internationally where, care is getting a little bit diminished for whatever reason, whether it's revenue is the prime driver or some other, component of it. So I want to kind of find a way to try to bridge the gap between still providing quality care, but having a sustainable, successful business. So I'm 8 years in and been through quite a unique dynamic with, COVID and some other avenues that as business owners, we run into roadblocks and other problems that we can't expect. So it's kind of always just up and down with it. So I was knowing as time was going on, I've always wanted to have an integrated practice at some point. So I was able back in 2019 to purchase my own suite that I work in right now to be able to integrate other forms of, healthcare providers, whatever it might be. So for a little while prior to COVID, I had an anesthesiologist that was in here doing some work with me. So he was a friend of mine and kind of got tired of, just doing specific surgical work. So we wanted to integrate some clinical work. So we were working together to try to find a more efficient, effective way to address patient problems in office from a, management of truly the medical side, along with like the physical therapy side, to expedite that process, give patients, care that they typically wouldn't get as efficiently and quickly, and find a way to alter that. And so that kind of started the whole process with it. And then back in 2022 and early 23, I'm a founder, one of the co-founders of Unwind Wellness, which basically is bringing non-traditional modalities like red light therapy, exergen with oxygen, PEMF, things like that, to figure out how those from a science standpoint can be integrated into a practice to provide, alternative measures besides just medicine. So my big premise was medicine, wellness, it's all on the same spectrum. It just depends on where that patient is. If somebody's sick, injured, hurt, has surgery, they're more medical driven. Someone's past that process and now they're recovering. Well, their medical care doesn't stop. It now becomes wellness. And so we wanted to find a way to make it medically driven from a wellness side versus, some of these just random wellness facilities that pop up that may not have a medical component to it, and figure out where along that spectrum is the patient and how do we keep them in that spectrum and more on the healthy wellness side versus having to resort back to the medical injured side. Because we see that all the time, right? People get better, they're done. Well, we don't do much to sustain that and keep them from getting back, whether not hurt or injured. So I wanted to find a way to have them continue to be in my practice, but not always treat them on the medical injured hurt side. And so that's kind of how we integrated a wellness component, and it's still in the early stages, but we're seeing some pretty cool changes and benefits for people.
Amazing. I think you mentioned in our email conversation that you were blending clinical and corporate wellness. Is that right? And are you, and can you share how you structure that from the kind of the corporate side?
Yeah, that's kind of dependent on the individual kind of corporate component. So one of my co-founders here has kind of been more in the business corporate world. And so he was at a huge company around here. And interestingly enough, their companies, one of their biggest focuses was adding wellness services to their employees, because they're starting to figure out it helps with retention, it helps reduce costs, things like that, which most maybe companies don't focus on as much. So we wanted to find a way, well, how can we integrate, data-driven, research-based modalities to help that? So we recently just were involved with one of our local hospitals in a fairly well-known institution in Dignity Healthcare out here with one of their hospitals that's 2 miles down the road in their Nurses Week and Providers Week the last couple of weeks. So we opened up doors for them, provided free services, just kind of treated them on, hey, listen to, wellness aspects of it. How does it impact you as a provider? What can it do for you? How can we integrate care for you as well? And so that's kind of a slow start of the corporate wellness that we're adding. And then as time goes on and we figure out what the needs of each corporate partner might be, what are they looking for? One of the partners we've been looking at, they do like BMI testing, old school testing, body weight, nothing that's really that accurate. And so we've got like a 3D body scanner that we've been using for a while. And so now it gives us more data. And so our whole premise of everything we do is we don't know where you're going to go if we don't know where you're starting from. And so we try to get as much baseline data as we can to figure out when we're doing some of these non-traditional modalities, where are we seeing changes down the road and not just, external changes. So we've also been trying to find, companies to do different blood work or different biometric testing, things like that we're slowly getting into, because then we can actually show that not only are you looking better, maybe externally or feeling better, we're actually seeing those changes internally in your body as well. So it's not just an appearance look, it's kind of a total package that somebody's improving on.
Got it. Do you have any particular kinds of clients or companies that you're working with on the wellness side? And is there sort of particular kind of companies that are more on the uptake for this kind of approach?
So I think getting in the healthcare system, I mean, you and I both know as providers, I think sometimes we prioritize our health maybe less than, some of the patients, because our whole role, and I see it in the community, I go out and, people talk about like, oh, hey, I see one of my healthcare people, like we always run into patients with it. And then if I take time off, they're like, hey, where were you? I'm like, well, I had a doctor's appointment or had to take care of my own stuff, and I think sometimes it's a misconception that, healthcare workers don't need any healthcare themselves, and so I think that's one big trend that we're seeing is a lot of these hospitals or companies are trying to figure out how to provide treatments or wellness modalities to their own healthcare providers so that we don't forget about them, because I think it's a very common thing that gets left behind is how do we take care of ourselves when our primary goal is to take care of others? And it's just something that's harder to trend. And I think companies that value that, we're starting to see better retention rates. They're noticing that, there's maybe less resources spent for time off and having to find coverage and things like that. And so we also look locally right now on companies that value wellness. And so we're trying to find companies that have wellness programs or that are looking to add wellness programs. So we know that there's at least interest from them, and maybe they don't know how to integrate it or implement it into their own business, but we do. And our goal is to figure out, okay, what are your needs? How can we work together? And so we're trying to figure out how to have the baseline information and products available for them. And so we just partner with them so they don't have to figure out how to do it on their own. That's where our job is coming into play, is we're trying to integrate that into the wellness aspect for them so they don't have to do it, because that's not their primary role. So if you're, an engineering company or a tech company, you're likely not going to have, you may have a wellness person on staff or something like that, but you're not going to probably have as much experience that we might have integrating this, for several years. And so we're just trying to find people that have an interest of adding this to their business to hopefully, keep their employees healthier, happier, and just enjoy where they go to work every day.
Brilliant. What major shifts are you seeing in rehab and wellness space right now, probably, and especially in your local area in the Arizona market?
So the big change is a lot of, smaller companies like myself, especially the last 5 years, have kind of gone to a bigger corporate realm. And so within the last year or so, there's been several different single owners like myself that have kind of come together. And we've kind of created our own little mini network where we kind of have like a sister company now that we've created that oversees all of us, just to help expedite with some of the back end things, as it's harder to run all your own billing, all your own HR, all of that stuff. So instead of having to go to a true corporate field, we can still run and own our businesses like we've created with it, but it's taking some of that back end burden off of our hands. And so that's a big thing that we've been trying to add. And so with that kind of partnership and merger, we've got a physician assistant that comes in. And so she comes in once a week. And so if we need something medical, we don't have to worry about referring out to somebody else, waiting for that time frame, then referring potentially to an orthopedic specialist. So we're trying to integrate even more than just the wellness side. Like, how can we add a true medical side as needed, quicker and efficiently, like in my clinic, in all of our locations, we do diagnostic ultrasound. So, there's a lot of effectiveness with that with certain conditions. So if somebody walks in, we're not waiting, weeks sometimes for a high cost MRI. If it's not necessary, we can get a baseline look, then determine kind of what route to go. So we're just trying to make things more efficient and effective. And Arizona is one of the, I guess you could kind of say, leader with what's being done in the PT world. So a year ago, they've given all kind of physical therapists the right to order any imaging as needed as well. And so we can do simple x-rays. There's even a potential that we're trying to figure out how to use it, like simple blood work if we need that for a patient, things that we can do. So we're trying to figure out, one, what's our scope of care, what works for us, how do we integrate with a medical provider as needed, like where do we find that limit of what's appropriate for us, but also efficiently with the patient. And having somebody in here that's kind of a sports med, non-op trained person allows us to bounce ideas off them, work together, and we're seeing massive changes. So like an example is I had a lady that came in here. She went to go get an MRI, took her 3 or 4 weeks to get in there. She shows up and they canceled it on her because they said, oh, your insurance required something that they told they didn't, right? So by the time we actually had her come in here, take a look, she literally was almost done with care by the time somebody else needed to get another image. And so people are getting treated, they're getting what they need quicker and faster and more efficiently. And so we're trained to understand, is it appropriate for, PT? Is it appropriate for a referral? Where are we at? And so we're trying to minimize, an immediate referral to a surgeon if unnecessary, because for them, they're getting overwhelmed too. I mean, there's so many patients in Arizona as it's growing. We know there's a massive need for healthcare providers. So if we can kind of ease some of the burden for the, I wouldn't say less important, but not as specific surgical cases, a lot of doctors are liking it. So then they know when we refer to them, they've kind of passed all of those non-op things that are, hey, these are not working, or here's what they've done. And it's expediting that process for them as well too. So we're seeing kind of a seamless transition, which often you don't get in many states, or who knows around, internationally as well, how that works. But we're seeing a huge change with integration, and really patients are loving it.
Amazing. Would you say companies are becoming more open to preventative and wellness focused care? I think by the previous thing you were saying in conversation, you've had some healthcare providers which are wanting to do things for their staff, which is great because obviously medical professionals need it. Or is it an uphill climb in general?
I think it's still an uphill climb to an extent because they're larger companies, but there's a lot more people that are changing for it. And I think generationally things just change. I think, whoa, light shut off here. I think it's kind of a generational change. So some of the younger, generations, I think, have more things that they're interested when they come out of school as a job than maybe what I did 15 years ago, than maybe what somebody did 30 years ago, just because there's new technology and things available that we didn't have. So we're having to adapt to the market, the technology, to what that generation wants. And I think for them, they want a job that feels like they can be integrated, stay there, kind of have a lot of their needs met. And, sometimes it's not easy to meet all of those, but we're seeing a health and wellness program is a big thing. So I've been on forums and looking at different research things, and they're finding out that, a lot of people want health and wellness. And so if we can talk to, different companies, or, we're even trying to integrate what we call kind of strategic partnerships with other medical practices that want to add this. Like they're finding that retention rates are better. Employees are maybe wanting to go work there because now they have access to something that normally they might have to pay on their own to go elsewhere. Well, now it's actually in their own office. So it's still an uphill climb. I'm big on looking at the literature and researching everything. And so we always know that the research says one thing, but to get into clinical practice, it takes some time. So, but someone's got to try to kind of grind away and get that change done, because if no one's willing to push through and, we get stagnant, or we know it's going to go in the opposite direction.
Got it. So with the changes in the industry, how are you sort of positioning yourself at Bloom to stay ahead of things and sort of be market leader?
So I think the big thing is really that integration and pushing like the wellness aspect. So just looking around and knowing the market, like it's very unknown to a lot of people, and we're finding out that as patients are coming in, they're looking for some of this stuff and not knowing where to go. So if we offer this, knowing they're already looking for it, for us, it makes sense. Then why do we need to potentially refer them elsewhere? So it's great from kind of a twofold standpoint. Patients want it, and then it can be good for a kind of a secondary revenue generation. Because if they're trusting what we're doing on one aspect of it, then why can't we find a way to integrate something else that patients are already looking for that we know they're going to go somewhere else too? But now if they know they trust what we're doing medically, why would they not trust us on a different avenue with it? And so it's trying to educate, inform, teach people that. But I think if we're not making a change and pushing forward, I mean, I think we're going to see a big decline with, especially with some control from, insurance reimbursements, things like that we can't control. So we've got to be able to control the things that we can. And some of those are, different business models, different approaches, modalities, techniques, things like that to continue to revenue, increase revenue, but also provide quality care and services that patients are going to be looking for to help in their healing process.
Got it. So what's working well for you at Bloom right now in terms of all your initiatives and the things that you do? And I know some of these things you've mentioned, but what's particularly working well for you as a business?
I think the things that are really working the best are working with, either those other, doctors, physicians, surgeons that understand what we have to offer. And so we've got people that come directly to us that would be like, hey, go to this PT place because we know they offer wellness modalities as well that I think would be good for you. So we're starting to see a small little trend of, not even just physical therapists, but other healthcare providers that are starting to know more about this stuff. Because it's not really traditional medicine by any standards. And the thing that people don't realize, like a lot of this stuff has been around since the 70s and 80s. I mean, NASA was kind of the first one to experiment with some of the, PEMF and some of the red light, and then they used it for kind of other reasons, and they slowly kind of integrated it. There's more research on what it did at a cellular level, things like that. So for me, it's always been a medical component, but it's just never been well known. So if we're now able to figure out how to work with other providers that know the benefits of it, now when a patient comes, I think their expectation is, hey, I'm not just going to get PT or like what they think is the basic care. They're getting additional things that a lot of other places don't offer, because both their provider and then coming to see us, our goal is trying to be as efficient and effective in your care. And so here's how we're integrating these together. So, and as time goes on, trying to find more and more people that understand about it. And I think it's with anything that's new out there, you're always going to have some of those early adopters that want it, people that are hesitant and say no, and then that middle population that wants to learn more. And so we're really trying to work with those providers that understand the benefit of it, that maybe they've used it. And I think what we're finding is, even kind of like yourself with whether you're a non-traditional medical provider, whether you're a naturopath, functional medicine doctor, even chiropractic care, things like that we would consider non-traditional, we're typically more open to some of those changes and ideas because they're already using some of that. And so that's kind of where we're seeing that benefit. And so I think there's always been too much of a clash between providers. Like I always tell all my patients, I'm like, if you're going somewhere and you're getting the benefit that you need, I'm never going to tell you to stop doing something. Let's find a way to work collectively together and find maybe something that's being missed instead of being like, well, no, that's not being done the right way. Like, how can we add to your care and not feel like you're starting over? And so that's a big push that I do. I think a lot of people get turned off and they say like, well, I don't want you to go there. Well, you just told me that you're getting benefit from them. So why am I going to tell you not to go? Let's find a way to add things that you aren't currently getting with different things that we can offer, and then see how collectively that treatment together is going to improve your care. And so we're starting to notice more and more of those providers that, are more collaborative instead of, feeling like we're, two different businesses fighting for the same patients. We're seeing that, hey, we can actually work together and be successful and not push against each other.
Interesting. And on the flip side, what's been sort of frustrating or slower than expected as you sort of grow and take your business forward?
Number one thing, like anything, patients don't really fully understand a lot of the new additions, and we kind of get stuck in our old ways. And, there's still some that's like, well, let me see if I can, do more research or figure it out, or I've never heard of it, so I don't know about it. And, that's kind of a challenge. And then you get some people where like, well, I don't know about it. However, I trust what you've done for me. So if you're bringing something in, I'm willing to learn more about it. So I think it's always a unique challenge because I think patients are always hesitant. And I mean, the reality is, I think to some extent, we've all probably been burned a little bit by something in the healthcare community, whether it's a provider, an insurance bill or something where it's like you show up and it gets canceled. Like, I think there's just that natural hesitation at times. And so I think they're kind of that fear-driven component of, well, I need to make sure I'm fully ready to understand what this new part is, because in the past it hasn't worked well for me. And so I see a very kind of unique, complex patient population myself here, where that is definitely what's happened. They feel like they've gotten burned by the community, the different medical providers, maybe even from like medications because they have reactions to it, and they're told, well, this is the only thing that can help, and so they're not sure where to go. So anything that's new to them, it's kind of an immediate like hesitation that kicks in because they're like, well, here we go again. This is the same thing I've done before. So it's trying to be honest and open with people and say, hey, here's the information. Here's more information for you to research on it. Like, this is where it's at. Like, and just exposing people to the reality of it. There's a lot of false information that's out there, right? They may hear one thing from somebody, but don't completely understand the story. And it's like, well, that's not the normal, that's probably a bad story or something that you didn't heard correctly. But, how do we get patients to understand? And what I tell them, I said, my goal is for you not to come back and see me on the medical side if we're adding this. My goal is for you to stay healthy and to continue maybe under my care on a different realm so we don't have to treat you to get you back to baseline. Why can't we keep you from baseline and beyond? I don't want to just get you back to your baseline levels. And so as they start to understand that more, we give them more information about it. I think they're starting to realize, being proactive is really the best way instead of being reactive in medicine, which is mostly what we do, right? We don't focus on keeping people healthy. We focus on keeping or getting someone sick to get them back to being, that baseline health. So how can we be proactive? And there's some people that are interested, but I think there's just naturally a hesitation from patients.
Are there any particular modalities that patients are more skeptical over than others?
So I think right now the PEMF, right, that's not as known. Like EWOT, the EWOT is similar to like a hyperbaric chamber, so they've kind of heard of that. Red light, I think, is the more well-known thing. I mean, a lot of like dermatology places have been using. I tell people like, well, think about blue light. You see, they probably don't realize it, but I'm like, your dentist has been using that for you for years. Different light wave spectrum, different process, but light's being used all over the place. You may just not realize it. So that's more known. I think it's more of like the flashy modality, but I think PEMF was just not understanding, and like they're thinking magnets and electric, like do what? How's that going to work? And so that, ironically, is probably the one that's got the most medical value more than anything with it. So that's the one I think that's a little bit of a harder push initially until they use it, they see it, they understand the changes to it. The other ones are a little bit more known, I guess, and whether it's online or by friends that have done something to it, or they at least have heard about it, where the PEMF is kind of the more unknown one, but I think honestly probably has some of the most advantageous benefits for people if you understand how to use it correctly.
Are there any particular metrics or KPIs that you focus on in your business, the ones that are most important to you, or anything that you're particularly focused on trying to improve?
Yeah, I think the big one is trying to figure out, retention is always key for me. I think and I've talked with other business owners, and everybody always wants new patients, and I'm like, that's not really my focus. My focus is to retain the good ones that we have. Because if you're always trying to get a new patient, it feels like you're trying to start from ground zero all the time. Where now, being in business long enough, like a lot of my, I guess you would call like new cases that come into my office are old patients because they know where we're at. And so that's an easier, not sell in medicine, but their expectation is already understanding like, hey, I know you've helped me before. This is something new. I don't have to try to, hey, here's what we do at PT. Here's how our company works. Here's what our plan is. Like, they already know that works. And so we also try to look at, how many people come to us from past or former patients. Same thing like with expectations. Their expectation is probably already going to be that, hey, they may get some help here because they know somebody that's already been here. Where if you just find somebody new, random online that just finds your office, doesn't know anything about you, it's like you're starting, like I said, from like day one all over again. And now you got to gain that trust and understanding, where if you can keep a variety of people that have been through here that then share with others, that's why, personal testimony or referrals from past and current patients are always easier typically to work with, because their expectation is, hey, I know I'm likely going to get better here, even if we know anything about it or not, because they know somebody that's been through here. Where the harder ones are, I've been to PT several times or other medical providers and never got much relief. I know that they're already in that guarded state, which, interesting with my background from a neuroscience standpoint, we know that that increases their pain response. So I'm already dealing with somebody that's in a heightened state coming in to see me on day one because they've already been failed by the system. So that's a much harder change versus somebody coming in expecting like, hey, I know I'm going to get better because I've been here, or my friend or whoever it was got better. So that's what I'm anticipating when I walk in the door.
Interesting. So you mentioned retention. So have you got any sort of key insights about the things that lead to good retention and things where you find is it probably a cause for them to drop off?
I think benefits of showing up, right? I think value is the biggest thing. And I think, value is kind of a word, but the value's got to be like, what are you here for? Like, what are you trying to achieve? And so if your goal is like, hey, here's what I want to get out of this, I try to be as realistic with them on day one. Like, somebody's trying to come in with a major injury and their goal is to go back and run, a marathon every month. Like, okay, it may not be realistic. However, let's figure out what is realistic to get you back to that. Where do we kind of find a common ground? So I think the retention is really tied to realistic expectations, both from the provider and from the patient. So we've had like a current patient that's come here, and she told us she left another office because she's like, oh, I'll get you back, full running in 2 weeks. And she's like, well, based off what I've looked up online, she's like, that just doesn't match up. And so she was already hesitant because what she found online as a patient didn't seem to match up with what was being said in clinic. And so I think realistic expectations, I always tell people some of the greatest things I can tell you is I don't know, but I can probably find out. So I think we try to solve all the problems for everybody or think we know all the answers. And that's probably the greatest answer I can tell somebody. Or I don't, but I know somebody that does. Or, hey, here's what we need to do first before you come back. Because then they feel like they're getting the care they need and not just trying to be kept as a patient for purely a business model. And so that's something that I definitely found is people having the trust, which honestly has been lost a lot in healthcare because they feel like a lot of times they're just a number versus an actual patient and a problem. So I think retention is really tied to trust and realistic expectations on both patient and provider.
Interesting. So fast forwarding sort of 6 to 12 months, where would you like to see Bloom go in the next 6 to 12 months?
My ultimate goal is I'd like to be a little bit less in clinic and do more from a teaching standpoint. So I'm also clinical faculty for Tufts University and their PT program down here. So I actually get ready to go teach here in a few weeks. And so I think the biggest thing, the reason why I like to teach is there's a lost integration, I think, between academia and research and clinical. And so at least here in the States, that's kind of the big trifecta of what we're doing as far as like the big three with it. How do you integrate research with, patient preference, the clinical side, academia? And I think there's a disconnect. So like I've got a student here right now that's from Tufts that I taught, and he's quickly learning that, wow, like there's a little bit of a difference between what we're taught in school versus what the clinic is like. And so when I try to teach, I want to be able to be realistic with students that, hey, this is the baseline info. You got to understand how to work this, but now let's teach you how to clinically reason and have rationale for what we're doing and why we're doing it in the clinic. And so I would love to be able to have a clinic that's continuing to grow without me being the primary provider, and be able to educate and teach some of the younger up and coming clinicians on how do you sustain and run a business like this in a world that's ever changing? How do you integrate a medical model that we have with a wellness model? How do you actually take, what you learn in school into the clinic? And I think that's a lost art, not just in PT, but I think that's for every student that comes in. I know that's how I was. I went to Duke University for PT school, and I feel like I had a great training, but there's only so much that you can do at school before you get into the clinic. And so just trying to figure out how do you integrate that better. So as a patient or as a provider starts early in his career, they're not feeling like they're on an island and they're like, wow, man, this is way different than I taught in school. So when I try to teach, I teach them, what we need to do clinically for the academic session, but it's like, okay, now how do we actually integrate this to real life practice and use this on a patient? That's where they seem to start to get a better understanding of that, because they're now reasoning versus just picking a technique and using it.
I'm big on education as well, so I've got some academic roles at the university, so I'm completely aligned with you on education, especially when you want to kind of spread your word about how you do things and to give a different approach. But I suppose the question is, how are you going to release yourself from your business to do that?
So I've already started a little bit. So
Mm.
with kind of some of this partnership, it's giving me the ability to not have to work
Mm-hmm.
as much behind the scenes. And so they can take care of the things that I was putting odd hours into, and,
Mm-hmm.
something simple as just like HR and hiring, some of that. So part of why I did it is, one, it allows us to have a more integrated practice that I couldn't really do fully on my own, gave me the ability to open up and do more. And so now I can really push the wellness side, can kind of push the teaching side, like the things that I feel like for me, when things started to become a better provider and understand the whole system, all of these things were integrated. Like, you need to understand what you got to do in academia, but then what does the research say that supports that? But then how do you take those two and integrate it with the clients? Okay, now the client's there, the patient's there, now they're at a point where they're back to where they want to go. Well, then now how do we integrate a wellness program to keep them healthy, right? So I feel like we get taught in little blocks of certain things. So this is the medical side, this is the academic side, here's this side. Well, how do we fully integrate that so that the spectrum of care for a patient from their kind of starting point to their ending point is more consistent? And so the only way to do that is someone that's willing to kind of take that chance and try and integrate it and hopefully see it works and have more people wanting to do it.
If you could remove one roadblock overnight, or challenge or a thing which is limiting what you do, what do you think that would be?
I'm mostly in the insurance world out here, and so this is one of my immediate changes. I wish every clinic, every hospital could take every insurance, right? Everybody, regardless of where you at, got reimbursed the same, because then you're now at a standard where care drives the quality, not the other way around. So like if a patient knew, like, hey, if I go anywhere, like, I'm gonna have to pay the same. Providers know I'm gonna have to make the same, right? Now, if like some patients like, well, I only have one option. Well, if that's your only option with it, like, it makes it harder for it. So if we can make everything on a level playing field, then I think you're going to see a difference where quality is going to have to eventually come to the top with it, because if patients know, well, like, hey, if I go somewhere else and everything's on a level playing field, I'm going to go get what I want to do. And I think we've held ourselves less accountable over time as providers. And it's not as simple as just, that aspect, but because there's obviously a lot to do with patients and their mindsets and what they have to do. But I think if you just make it as simple as you can, where competition will speak for itself, which is a good thing, where it should boost the quality of everybody that's being done. Because if you're not really putting in quality to your patients, but you're getting paid 25% more than what I am for the same contract, and I'm having to do more work just to make up that difference, like, for some reason there's a level of fairness that I think is thrown out the door with it. So if we make everything across the field reimburse the same, pay the same, no regards with any of that, then it's going to really make those people that are higher quality stand out, and patients will know that, because there's not going to be any difference for them or for us.
Got it. I think I've spoken to quite a few people in the US, and I think everybody has mentioned the whole insurance reimbursement thing as one of their roadblocks.
Yeah.
And we don't have it in the UK in the same way. We have a sort of government-funded health system, but it seems to be a universal issue with all the US-based health and wellness practices. So it's interesting.
Yeah, and it's kind of interesting because we get a lot of Canadians that come down here too, and so we get a lot of Americans like, oh, I would love to be in Canada, and they're like, well, I come down here for US because the system up there limits what I can do, right? So I think the guiding solution and answer is, all of healthcare is probably not the greatest it could be, whether it's nationally funded, privately funded, a combination. Like, we've got to figure out a way to get back to what's the premise of what healthcare is about. And we all know in healthcare, I mean, it's one of the largest business industries, for each, economic source in each country. Like, it's a humongous revenue generator, but we didn't go into it for just that, right? Like, obviously we want to make a good living, but we're here to treat patients. And so how do we not let a system govern what we do for somebody, but knowing that right now we got to kind of play in the system that we have to be able to still make a living, to get quality for a patient. And I think that's why you're seeing, even retention of just providers is dropping all the time. I mean, I forget what the stats are, but man, the number of like PTs specifically that I know that basically get out of the profession every year is, I don't think, at a point where we're having that same comeback as new providers. So I think our total number is either very steady over each year, or even starting to drop a little bit below that, because people are just getting burnt out a little bit, or they don't look at alternative options. And so, I mean, entrepreneurs are very different. got a different mindset of what you want to do. And we know that nothing is ever easy. So you always have to encounter roadblocks. And so it's always like, well, how can we change that? And if you don't have an entrepreneurial mindset and you're just a provider, which is great because we need those, but you're starting to see that this not working for me. Like, why would I do all this work? And it's just, making my quality of life worse. And I think we're seeing people change the industry. I know in my class of school, like I already know a ton of people that have gotten out of the field the last 5 or 10 years. They didn't last long. So that's not a good trend for healthcare. And, you put all the time and effort and knowledge into it and, people are leaving, then this kind of waters down the quality of medicine that we're providing. So there's got to be a better way to do it from both a private and a kind of federal, national level too, but not sure what that is, but hopefully someday we'll get there.
Brilliant. Eric, thank you so much for your time this afternoon. It's been such an insightful conversation. I'm sure there's lots of learnings here that will resonate with our audience. So really do appreciate you giving up your time for this session. Thank you so much.
Oh, appreciate it. Yeah, well, thank you, Dr. Greenland. And we'll keep in contact and you keep pushing along with what you're doing. Like the only way we make changes is someone steps out and tries to make the change. So I appreciate your time with getting me on here.
Thank you.
All right. Take care. Have a good one.